Welcome to another St. Mary video. Today we're going to talk about how we document our discharge process. Back in the good old days, pen and paper were all we had. We would speak to the patient, speak to the nurse, get to the chart, look for an 11 by 17 carbon copy document that had about 6 copies in it, and go ahead and start writing out the medications and follow-up appointments for our patients. That writing process included the thought that we put into the discharge process and gave us time to look through all the available documentation and information manually with our hands in a physical space that was controlled by us. Although the hospital is not well known for having a lot of space, most of us had a good 4 by 6 foot space to do this process, often taking over countertops and any available surface. Moving this whole process to the electronic world has, among other things, eliminated that space, and that's made it a little bit more difficult to do this process safely. And maybe this is part of the reason we as an industry initially had some difficulty in showing the value of doing our discharges electronically. However, times have changed, systems have improved, and we have improved, and many of us are able to use our electronic resources much more efficiently and faster than ever before. We've been able to produce a really nice system for producing this information electronically in MEDITECH. And for those that are already using electronic documentation, doing your discharges in this way is a no-brainer. If you're anything like me, you have a lot of trouble dictating your discharge summaries. This new system will save you the hassle of dictating a discharge summary ever again. This video is long because I'm explaining all of the background that's involved in the discharge documentation process. However, if you speak to people that use the electronic documentation process, you'll hear commonly from them that it takes them minutes to complete the process. And this is especially good for groups that have multiple providers taking care of the patient on any given stay, because the EHR serves a very important function of coordinating the care between the providers and serving as a place for communication among the team members. If you know what your patient is going to go home on and you've already planned out all the follow-up that's necessary in the patient's care, the entire discharge process shouldn't take more than 5 or 6 minutes. The actual process of creating the discharge summary document can take under 1 minute. So let's get started. Okay, this is going to move pretty fast, so please feel welcome to pause the video at any time. The first thing we're going to do is get to our Documents tab, and typing in a few letters can show you all the discharge documents that we have. So in brief, this includes the Discharge Note, the Discharge Instructions, and the Discharge Summary. Disregard the Discharge Comprehensive template at this time. That's really used on the Discharge Instructions and is a topic for another day. So once you pick your Discharge Note, it's a pretty typical template. All it is a progress note that's used on the day of discharge. So it has pretty much all of the same fields that you'd have in a progress note. However, it's got a few additional fields to accommodate the discharge. And just like any progress note, it'll pull in information from a previously documented progress note. There's also a primary care service progress note that is very handy when doing your discharge documentation. And this is where that primary service progress note is helpful. The primary service progress note also has a clinical summary field where many of us keep the patient's current story. This clinical summary is essentially a hospital course, if you really think about it, and can be used in this discharge note in the hospital course section. Because there's no primary service progress note on this patient's chart at this time, I'm just going to go ahead and type in some stuff for this patient and finish up this note. So that's what the first thing that I would do after seeing the patient and discussing the discharge. So now the discharge note is done, I would move on to the discharge instructions, which again is a topic for another day. There's a video on the discharge instructions that you can find on the St. Mary YouTube site. And we're going to move on here to the discharge summary. And the great thing about the discharge summary is that the majority of the fields will get pulled in from all the work that you've done in your discharge note and your discharge instructions. Unfortunately, you have to actually click on these fields and pull in the information manually. However, once you get used to doing that, it's actually pretty easy and it can be really, really fast. And just like any other note, this note can be created on any given day, including the day of admission. So once you're in the discharge summary, you can see that the problems were pulled over, as well as a bunch of other fields. Unfortunately, some fields need to be typed in, so I'm going to go ahead and do that here really quick. If I use the F12 key, it'll advance us through fields. I'm somebody that doesn't like to use the mouse and tries to use the keyboard whenever possible. I'm bringing in the information from the discharge instructions by clicking on the edit button, and now I'm selecting myself as someone that's going to get a copy of this document. And what's great about that is the send copies to function allows the receiver to get these documents prior to the patient even being discharged. Now that's an outstanding standard of care for people that use this function. Your end result can be a really nice looking document, especially if you take the time throughout the patient's admission to populate the clinical summary field, use the discharge note on the last day of the patient's stay, do the discharge instructions, and use the discharge summary. I'll tell you, I've saved countless calls from the HIM department and a lot of scorning from my physician leaders in completing discharge summaries for my patients. Thanks for watching. Stay tuned for more St. Mary videos.